Okay, welcome everyone. I'm Divya, and in today's session on proactive heart care, how can knowledge and tools empower us? We will talk about how, in a world where heart disease is so prevalent, the power of knowledge and access to the right tools can be life changing. Now, in India alone, cardiovascular diseases account for nearly 28% of all the deaths, making heart health a very critical public concern. Early detection, preventive care, and informed lifestyle choices can significantly reduce the risk of heart disease and improve overall well being. So, now let us go and meet our esteemed panelists that are joining us today. We have Dr. Anshul Jain. He's a senior consultant and interventional cardiologist from Jaipur Golden Hospital and Fortis Hospital, Shalimar Bagh, New Delhi. We have Dr. Deepak Kapila, Director Cardiology, Fortis Scots Hospital, Amritsar. And we have Dr. V.S. Ramachandra, Senior Consultant Cardiology, Director Cardiology, Sri Sri Holistic Hospitals, Hyderabad. Welcome to all of you. Okay, and now with our esteemed panel, let's explore how understanding the science of heart health and combined with the latest diagnostic and management tools can enable us to anticipate, prevent, and treat heart diseases more effectively. So, starting with Dr. Anshul Jain, Doctor, what fundamental understanding of heart health is essential for everybody, and and why is it so crucial to have proactive care in place?
Yeah, hi. So that's a very important question for public to understand because India is fast on its way to become the cardiac disease and diabetes capital of the world. As Southeast Asians, we all are predisposed to heart disease because of our genetic element, which just makes us more prone to developing the disease. Now, heart per se is a very important organ like other organs, but it's got a very special emotional aspect which makes it special. Okay. It's the only one and single in the body. Works tirelessly between beats and it just rests when it's beating. But between one beat and two beat, it rests. So to keep it happy, we need to do something very simple. And simple by simple, I mean you need to have a very simple way of life, lot of exercise, and a normal healthy diet. By what do we mean by healthy diet? We mean that it should be free of heavy fats. There should not be excessive salt and sugar. So just to simplify, normal sugar, normal salt, and low fats, that is the way to go with lot of exercise. What are the risk factors which predispose us to heart disease? A word to remember is DOL, D for diabetes, H for hypertension, O for obesity, that is motapa, and L for lipids. Lipids is cholesterol. And you add to it smoking. So if you have any of these five things, better avoid these things or control them thoroughly. That is the best and simple way to keep your heart healthy. So there is no need to go into in-depth details of the disease per se, but to keep your heart healthy and happy, take care of your health by simply being very active, adjusting to a healthy diet, which is moderate in sugar, salt, and fats. And if you have any of these five diseases, DOLS as I call it, D for diabetes, H for hypertension, which means blood pressure, O for obesity. By obesity, we mean that the abdominal size should be less than 36 for males and 31 for females. L for lipids means cholesterol, and S for smoking. So by these very simple measures, you should be able to keep your heart healthy and going strong. Thank you.
Absolutely. Now, Dr. Kapila, continuing on this, what are specific individual risk factors for heart disease, and how can personal health history of each individual inform prevention strategies?
So the whole concept of prevention of heart disease is basically based on the presence of risk factors. We have certain risk factors which, if present, give us more chance of having heart disease later on. Now these risk factors, they are divided into two kind of risk factors. One of the risk factors, one group is which is not modifiable. We call it non-modifiable risk factors. It cannot be changed. It's like the race. Male as such have more chance of having heart disease. Then a family history, a strong family history, there's high chance of having heart disease in postmenopausal women. So these kind of non-modifiable risk factors. Now we look at the modifiable ones, the ones that can be changed, reducing our risk of having heart disease. So the modifiable risk factors, as Dr. Jain also mentioned, first and foremost, I would say in youngsters today is smoking, lack of physical activity. Then, of course, the traditional ones like high blood pressure, high blood sugar, high cholesterol levels. And now we have new ones coming up is high stress, high mental and physical stress, especially among the younger generation, leading on to more heart diseases, lack of sleep, good sleep actually. These small things they can lead on later on to heart disease. Of course, among diet, a poor diet which is high in saturated fats and salt and sugars, that is bad. We all know it. And then alcohol, of course, we know everything in moderation is good. So all these things, when taken together, these days we have another risk factor coming up is pollution. The environmental pollution that is also causing increased incidence of heart diseases in the younger people. So all these risk factors, if even one is present, but if managed properly at an early age, we can prevent heart disease. That's why the concept of checking for these risk factors early, should start probably at the age of 20 years, so that we can reduce of the risk of having heart disease later on. Now, regarding the personal history, as you said, that's pretty important. It's a personal history record is I think much more important than our bank papers, because the treatment, everything a doctor would know looking at the personal history. The very important aspects being a history of any allergy, history of any previous drug intake, history of actually family history of risk factors, family history of heart disease, family history of sugar, family history of hypertension. All these history factors are so important. In fact, if we have a record, it really helps in the doctor putting in the strategies much more effective way. We have actually a new this aspect coming up, which is called pharmacogenomics, where the
Okay.
genetic studies can tell us whether a person would be responding to a particular treatment. A treatment would be a medicine would be effective in a certain individual or not, and we can tailor the medicine accordingly. So a more tailored approach in prevention of heart diseases now is the goal.
Right. I think that is fantastic news. And as both of you mentioned, Dr. Jain and Dr. Kapila, that all the factors have to be, taken care of, from diet to exercise to the works. And I also remember recently I was listening to an interview of one of India's sports stars, and he very categorically mentioned that it is so interconnected that you develop one good habit and all the other things start falling into place. Similarly, you go on to one bad habit and automatically everything else will, from sleep to food and everything else, will be effective. So I think it's important, as you specified, to have a very holistic approach to our personal health as well. Coming to you, Dr. Ramachandra, now how do the current treatments for heart conditions vary based on the type and the severity of the disease?
The bad thing about India is that half of all our heart attacks are in people less than 50 years. One fourth of all our heart attacks are in people in their less than 30 years. So this is pretty bad. So we need to actually start looking for these risk factors pretty early. Otherwise, a lot of our people will have heart attacks at a very young age. So basically, we need to look at all the risk factors that have been told by my other two previous speakers, especially cholesterol, BP, sugars, some special cholesterols like lipoprotein small a, which is more, genetically more common in Indians, and also look whether we are sleeping well, whether we are having less mental stress, whether we are exercising regularly. Nowadays, there are a lot of gadgets that tell us whether we have been able to exercise to the extent that is needed. So all these things need to be monitored from the age of 20 years onwards, almost every year. Now we have special tests like a CT coronary calcium score. So you can advise these tests for people who have some of these risk factors from age 40 years onwards, and they can pick up narrowings in the coronary arteries, in the arteries that supply blood to the heart from a very young age. So they can predict heart attacks almost 10 to 20 years earlier. these sort of tests, CT calcium, coronary calcium score. This is a very simple test, hardly takes 5 minutes, hardly any radiation, nothing being injected. So from the age of 40 years onwards, I think people need to get this test every 5 years at least.
Right, absolutely. And to begin with, one should begin as early as 20, which I think was not the norm earlier, right? So,
No, it was always 20 years. Yeah, nowadays maybe some countries advocate it to be started earlier also.
okay, all right. Now, Dr. Jain, what do you think is the role of statins? And also, aspirin is said to be extremely important. Now, what is their role in the primary prevention of heart diseases, and how should they be integrated into the health strategies?
Yeah, so that's a very important question. So what you are asking is primary prevention. So primary prevention means that you don't have the disease as yet, and you want to prevent developing a disease.
Hmm.
So let us take them one by one. So first is aspirin. Now it's a very common trend we see as physicians that people are munching up aspirin tablets, okay? For the fear of that they will, if in case they develop heart disease, it will save it. But let me tell you, scientific data is very clear, no aspirin in primary prevention. So it is absolutely clear, no aspirin for primary prevention, even if you have diabetes.
Hmm.
So why is that? So the scientific data is very clear again, that although aspirin might save little bit of myocardial infarction, which means heart attacks, it increases the risk of bleeding in a similar proportion. So if there's small benefit, there's a small harm also. So normal public should not consume aspirin in any case for primary prevention. That is first thing.
Okay.
Second thing is, who are the people in general public who may take aspirin? They are the ones who are having multiple risk factors like diabetes, hypertension, obesity, cholesterol is high, and they have a strong family history of premature heart disease. What do we mean by premature heart disease? That in their family, like their brothers or their uncles have had heart attack under the age of 50 or 55.
Okay.
So that is the only category which might benefit a little bit from primary prevention intake of aspirin. Otherwise, it's an absolute no for all people. That is about aspirin. Second question is about statins.
Right.
Well, yes. So the recent lipid guidelines from our Cardiac Society of India. Now, it has put general public at a low risk. That is because of our genes, because the Southeast Asians and Indians, we are
Hmm.
predisposed to at a higher risk of coronary artery disease. So, who is at low risk? Low risk is any person. All of us should have our LDL cholesterol, which is the bad cholesterol. It should be less than 100.
Okay.
So, should everybody be munching statins? Should 1.4 billion population be munching statins? No. Answer is no. If you have any propensity for heart disease, as I said earlier, you have a risk factor like hypertension or diabetes or a family history of heart disease.
Hmm.
There are the ones where we would like that even though you do not have disease, we do a lipid profile for you. As Dr. Ramachandra mentioned at the age of 20, if your LDL is more than 100, we should give a small dose of statins and then take it from there. Your physician has to be in touch with you when you take statins because they are not free of side effects. One need to monitor them. And remember, whenever you do a population change, a strategy for population, you have to look into account the economics also.
Right.
So please be in touch with your physician. It's not over-the-counter drug. You should not go to a physician and to a chemist and just say, give me a statin and you start munching.
Hmm.
So that would be my advice. That aspirin, absolute no. Statins, yes, but in consultation with your physician.
Absolutely. I think great advice there. All we need to remember is do not self medicate for any smallest doubt that you have, even if you've heard it through friends or wherever or social media. Just go to your doctor, have it ratified, get a prescription, and then get on to anything that is advised by your doctor. So, okay, Dr. Kapila, what lifestyle modifications are recommended for heart disease prevention in individuals without any prior heart conditions?
Sure, Divya. So, when we're talking of preventive strategies in patients or in people who don't have heart disease, we call it primary prevention. That
Okay.
is, we are preventing a heart disease. So, as we mentioned, it again depends on the risk factors we just enumerated. No, there are multiple risk factors. So, we have to prevent those or we have to treat those. So, it's very clear. The first I would say foremost today is get moving. So the lack of physical activity is leading on to this heart disease in younger and younger population. So a little bit of exercise, maybe just a moderate intensity exercise, maybe half an hour a day, really helps. In fact, they say as little as even moving 5 minutes during your working hours, rather than just being a couch potato, sitting on the chair all the time, climbing stairs instead of a lift, maybe. These small activities, they help a lot in preventing heart disease. So get moving, most important. Then comes the smoking. The please stop smoking. And the best thing about stopping smoking is whenever you stop it, you are going to get benefit. In fact, stopping it for 3 4 months makes you as good as a non-smoker. So there is, just when you stop it, you are good enough. So please quit smoking. And the most important part, Divya, is that don't be with a smoker also. The passive smoking is equally bad. When you inhale smoke from your friend who's been smoking around, even that
Yeah.
is equally bad. So passive smoking is bad. That Dr. Jain just mentioned. We add good things to our diet like fruits, whole cereals, grains, nuts, lean meats. All these are good things to be added to our daily diet. And what to prevent is, of course, not to eat is sugars, excessive salt, processed meat. They are pretty bad. And
Yeah.
of course, alcohol, which was said, if somebody is taking, should reduce the amount in moderation, maybe two small drinks twice a week. That is the safe limit, I would say, in drinkers. Somebody should not start taking liquor, to prevent a heart disease. And
Okay.
then comes the weight. It's very important to have a ideal weight. Obesity, overweight is really adding on to this burden of heart disease in the youngsters. We have very chubby kids today. They look good. They seem pretty, but this chubbiness in during childhood leads on to heart disease later on in the life. So this exercise, this weight maintenance should start right from childhood. Then
Absolutely.
comes,
There is
yeah,
no excuse for letting go of your health. Also, doctor, here I would like to ask you, do we also have, smoking is literally a thing of the past, or probably just the old timers are doing it. Now, the latest trend is vaping. Do we have any research on that also as to the cons of vaping? Of course, it is illegal, but still it's rampant.
absolutely, absolutely. And vaping is equally bad as smoking. So earlier it was thought probably the safer thing because there was, I think, less smoke involved. But
Right.
because of the the constituents of nicotine and all those things, it is equally bad as smoking. And vaping definitely is not a substitute for smoking. So vaping is a big no-no. It's equally bad or worse than smoking itself. So leading on to further, risk factors, as I said, stress, managing stress today is very important. Youngsters are in a race to excel, to succeed in life. So the stress catches on very early, and the parents, the kids, the youngsters should know how to manage their stress. In this, of course, physical exercise helps, but then things like yoga, meditation, going to religious events and all those things, reading good books, all these things, they help a lot in managing stress in day-to-day life. And then a good sleep, very important to get a good sleep. It's very common to see youngsters, keeping awake all night, whatever the reason may be. But at least 7 hours of good sleep daily really helps in preventing heart disease later on. And of course, then there are very important to have regular health checkups after, as we said, maybe after 20 years, or if there is strong family history, even during childhood, they say. In fact, in those who have very strong history, the first checkup should be done maybe at the age of 3 years.
Okay.
So, yeah, a regular health checkup, checking the blood pressure, the cholesterol levels, the sugar levels, all these are very important, when done in a timely fashion. And then more important these days today we say is preventing the infections, getting proper vaccination.
Hmm.
We should not ignore those guidelines, which are brought about by the societies, various societies, and we should be getting as advised. We saw the dilemma during COVID, people opting for or not opting for these vaccinations. Vaccinations, when advised, are good, and infections, if they occur more commonly, can again lead on to heart disease. Again, we saw that during the COVID. So all these things, these lifestyle activities, all these things are important and should start early in life to prevent heart disease.
Absolutely. So, again, I think the holistic approach is the best approach. And remember, what is good for you is good for your children, is good for your elders. So, probably having these changes in the entire family will make a lot of difference, and it will be easier for the other people also to come and fall into the bandwagon. So,
Sure.
if you are the one who's holding the torch and trying to bring a change in your family, please do that. Make the changes, and it'll impact everybody else. You improve your food, you include exercise, automatically stress levels will go certainly a little bit down. You will sleep better. It's all interconnected.
Definitely.
So, fine. Thank you, Dr. Kapila, there. Now, coming to you, Dr. Ramachandra, how do the current treatments for heart conditions vary based on the type and the severity of the disease?
Yeah, sure. The problem with most people is they think if they have an angioplasty or the bypass or a device for heart failure, they think the treatment is done. No, actually, it is still prevention. So it's always prevention, prevention, and prevention. And the prevention is mainly through lifestyle and proper management of risk factors, not through angioplasty or not through bypass. They are effective, of course, they are effective in saving lives when the patient really gets sick. But the prevention is again through these basic things. See, if a person has a heart attack and he has an angioplasty, or he has a chest pain and he has an angioplasty, he is mainly looking at how to not get it again, how to not get another heart attack, how to not get another event. And this is basically by treating risk factors to detect them early and treating them. So as far as the drugs and treatments are concerned, if a person has high blood pressure, we have these wonderful drugs now. Polypills in India have been available since so many years. Just 2 tablets, you can pack almost 5 drugs into them, and 95% of our people can have very good blood pressure control. That is less than 130, less than 80 diastolic blood pressure at home, and they should measure blood pressure at home. Diabetes is also very important to control, especially the lipids. The way to lessen heart attacks and to lessen repeated episodes in diabetics is to lower their cholesterol drastically. So all countries' guidelines say that whatever your baseline cholesterol, you should reduce it by at least 50%. And this can happen only with medicines, not just with lifestyle. So this is very important. People, we always see these diabetics who've been diabetic for 10 years, who are not on any medication for cholesterol, because they just check their cholesterol levels on a piece of paper and they say, okay, my cholesterol is normal. But that normal is for normal people, not for diabetics. For diabetics, all countries' recommendations say that whatever your baseline cholesterol, even if it is low, it needs to be reduced by 50%. And this usually happens with statins only. The third thing is we talked about lifestyle changes, especially sleep and snoring. This is a problem that you need to treat with pranayam, with bhastrika, with weight loss, and some people need special devices for sleep apnea. Similarly, with obesity. So all these things need to be done. As far as the treatment itself is concerned, angioplasty, I always tell my patients, is like, patching up a punctured tire. So if the person really gets that sick, then he needs angioplasty, he needs a stenting. If he has a very, weak heart, he needs devices to prevent his heart from stopping. But they are really people who have already had the disease. So the main concentration for the general public is how not to get there, and how not to, even if they have had it once, how not to get it again. And this is by treating risk factors like Dr. Kapila and Dr. Jain have already emphasized.
Right, absolutely. Now, Dr. Jain, how do regular follow ups and ongoing management play a role in the proactive care of heart health?
So, as Dr. Ramachandra mentioned, getting angioplasty or bypass is not the solution.
Yeah.
It is just like a patch up of tire puncture, but the tire is going to puncture again. So, what do we need? So, I'll just summarize how a follow-up is essential. So, it will have two parts. One is medication. You need to be in touch with your physician who will keep on adjusting the medications as per requirement, be it statins, the anticoagulants, the antiplatelets, or the drugs for diabetes, hypertension, etc., which are a part of heart disease management. The second part, which is the role of the patient per se, is taking care of several things, as we mentioned earlier. That is, has he changed from the day one to today in having controlled his risk factors?
Yeah.
Is he exercising? Is he meditating? Maybe doing yoga? Has he been able to cut off the digital exposure to less than half an hour? Has he been able to secure a sensible sleep, which is quiet and peaceful?
Hmm.
Has he started to exercise?
Yeah.
What has been the change in weight from day one to today? So it's an ongoing follow-up of your profile, be it weight, be it diabetes, be it blood pressure, be it cholesterol, and your own body. So follow up with your own parameters and follow up with your physician is absolutely essential for preventing the heart disease occurring again. Now you need to be really scared of heart attack or stroke because in India we have a recurrence of 10% within first month or first 90 days. So that is the yes, and this is a data which has come from our own studies in India, which
Mhm.
proves that almost 10% patients will have a second event within first month or first 90 days definitely.
Okay.
So so that is a proven fact. And we need to control the risk factors very aggressively, as Dr. Ramachandra mentioned, that the lipids have to go down dramatically to 50% of what their basic level was. So follow up with your physician in your medications and follow up with yourself regarding your parameters, which were abnormal to begin with, and getting healthy lifestyles inculcated in your daily routine. Discipline is at most important to keep your heart healthy.
Right, going back to the basics, discipline is the most important thing. You have to get in touch with your doctor, you have to be in touch with yourself. Apart from doing whatever tests you can do, also keep on checking, listen to your body. Is anything amiss? Is anything you feel is changed? Make a note and reach out to your doctor. Okay, now Dr. Kapila, coming to you, Dr. Jain also spoke about how we can keep a tab on various things. Now, how do you think advancements in medical technology? Now we have wearable devices which have come into being that can kind of keep track of how our sleep has been, how the REM is, how many steps we've done, etc., etc. How does all this contribute to better monitoring and prevention of heart diseases?
Yes, Divya, now this technology, we call it biotechnology, has come in a big way in helping treating diseases, preventing diseases, and actually monitoring people easily now, much more easily, especially those living in remote areas.
Yeah.
So, two major advancements I would say which have come, where technology has helped in the medical field. One is the integration of artificial intelligence, especially in the diagnostic this aspect, very important. And second, as you mentioned, is the wearable devices which have come up now, like the smart watch, which has become a fashion these days. Now, artificial intelligence integration into various machines helps in first is the diagnosis, a very clear diagnosis, very early, quick diagnosis from like echocardiogram, CT scan, or MRI. So artificial intelligence helps us in a very quick, a quick diagnosis than most of the humans can. And second, the risk prediction. For every individual patient, the intelligence can predict the risk of having heart attacks in future from the genetic factors, from the risk factors, the lifestyle things. It can put everything into the box and give us a figure. And third is it can give us real-time data how the heart disease is whether progressing or regressing or whatever. So that's how artificial intelligence, the biosensors, the nanotechnology, that's helping us even in delivering medicines right where they are needed in the body. And second is the wearable devices. Now we have devices which from where we can check everything about the patient, his heart rate, his blood pressure, his respiratory rate, his temperature. All these things we can find out from the device. They are either integrated into the clothes, or they can be worn over the clothes, or they can be implanted under the skin. So these are the wearable devices which are available. And then there are some which track even the blood glucose levels, on a regular basis during the daytime, so reducing the chances of having hypoglycemia, that kind of episode. We in fact have very good, hearing aids now, which help us, that they have become so small, they're not even visible, and they have become sharper. So all these, wearable devices, even the pacemakers now, they can predict, they can not only they regulate the heart rate, they can predict whether his heart is doing well or he's going into heart failure. So they can give that alarm. And we have wearable devices which can check the heart rate. And if they see any problem with the heart rate, if it's slow or it's very fast, they can give the alarm. They can give emergency alert. So all these devices now coming up are really helping the doctor in treating the patient, especially the elderly patient who can't move from the house, or the people who are living in remote areas, they cannot get a regular checkup. That's where now we are looking at a better care for all.
Absolutely. I think it's absolutely fantastic the kind of, how the technology is growing and really coming to help, especially in the field of medicine. Okay, now, Dr. Ramachandra, what potential do future technologies hold in merging traditional health practices with the advanced medical approaches for personalized health management?
Yeah, I like that word, traditional health practices, Divya. I think we should go back thousands of years. People always ask me, why do I have a heart attack? I don't have really high blood pressure, really high diabetes, really high cholesterol, but they have some of it, which means they have very mildly elevated blood pressure, very mildly elevated cholesterol, slight obesity, central obesity, especially in the abdomen region. And like Dr. Jain always says, like being Southeast Asians, it's the genes also. So when we have all these risk factors, and people think that, okay, why did I get a heart attack? It's because of lack of proper education. If you
Hmm.
really look at the way the body is structured, we should be exercising. We were exercising maybe 12 hours plus every day. We were sleeping when the sun set. We woke up when the sun rose again. We hardly had any mental stress, not the type of stress definitely that we are subjected to nowadays. So that sort of life can really prevent heart attacks almost 80%. And the beauty of all these lifestyle changes are, like you said at the very initial starting of this talk, not only can they prevent heart attacks, they can prevent all lifestyle diseases, which means your liver diseases, diabetes, so many other diseases. So simply you take a few remedial measures and all diseases are taken care of. This is not like, when you had all those infectious diseases, you
Hmm.
needed separate measures for malaria, for typhoid, you needed a separate medicine. This is not like that. One lifestyle change and all the diseases go away. So this is wonderful. I think when you talk about traditional stuff, we should really look back on how our great grandparents were living and try to emulate them. The other thing is, right now, what are the technologies that we have and how do future technologies integrate with them? So as far as medicine is concerned, it is rapidly evolving. You have now these stents that can vanish. You have valves that can be replaced just through your arteries. No need to open up your chest. In fact, the father of modern cardiology, Dr. Eugene Braunwald, is talking about injectable medicines that can be given once a year to lower your whole population's cholesterol a bit, so that the manifestation of heart attacks can be pushed to around 120 years, which means they're talking about nobody really having a heart attack just by lowering cholesterol. So that is the importance of risk factors: hypertension, cholesterol, overweight. If you can really take care of them, you have wonderful effects. So this is very easy to do. One great thing I would like to emphasize when we talk about tradition is yoga.
Yeah.
Yoga, pranayama, and meditation. See, meditation is a technique that's our age old, it is our development. And if you look at it, almost 40 to 50% of foreigners meditate. In India, I don't think even 10% or 20% meditate. If we can all meditate at least half an hour every day, it will have tremendous benefits. You will have auto regulation in the way you eat, the way you exercise, the way you react to stress, and a lot of health benefits also. So this is something that's very important. And if you want to actually, merge the future technologies with things like meditation, like
Yeah.
Dr. Kapila said, you have all these beautiful wearable devices that can tell how much you're exercising, how relaxed you are, and these will even get better, so that they will really can actually personalize these sort of treatments and these sort of interventions to each person. I also feel that the government should have a health ID for everyone in this country. It's not going to take much, maybe 100 rupees per person. They can have a beautiful health ID for every person in this country, because with simple lifestyle changes, they can reduce most of these lifestyle diseases by almost 80%.
Right. I think health IT is a beautiful concept. And as you said, yoga definitely is huge. I also got to know that the physical bit of yoga that we do, that is primarily to prepare us to meditate better.
Correct.
So I think it's very interesting once people get into yoga, and it is coming back in a huge way. It's coming back. It went to the West. It's coming back here, and I think that's a fantastic change that is happening. Okay, now as we wrap today's session, let's get some parting words of wisdom from all of you. Quick tips from all of you experts. So we can start with Dr. Kapila.
I would just say, all these factors which we have talked about should start very early. So make your children come out of their houses, their AC rooms, and start running, playing sports, games, and be with them. Guide them at every step so that they don't become obese, they don't get stressed, and they get good sleep. All these things should start very early in every household, and no age is late to start these modalities in every with everybody in the family,
Yeah,
children, the elderly, everybody should start whenever you are ready for it.
absolutely. Thank you, Dr. Jain.
Yeah. So I would like to say that let us be in touch with our roots. As Dr. Ramachandra mentioned very beautifully, the secret of health lies in going back to roots. Good meditation, good diet, getting up early, sleeping early, doing a lot of exercise, taking a healthy, normal diet. Yoga has been there since ages, and we somehow, it went out of fashion. And since
Hmm.
the West created fashion, we are back to it. That really helps your body being flexible, gives you energy, and since it requires discipline, you tend to meditate better. That is one. Second thing, we need to use technology sensibly. Now, the digital world, the digital devices Dr. Kapila mentioned, they tend to induce sort of digital psychosis in our youngsters. So, a feeling of an watch on your hand showing a heart rate of 120 or 140 just because it rubbed against your hairs or sweat, it sends you in a tizzy. And I have a lot of youngsters coming to me like it's like a cardiac neurosis which develops. So uh, you need to understand that they are just to guide you. They are not definitive. So we need to use technology sensibly and take it from there.
Absolutely. And Dr. Ramachandra?
Yeah, I think the most important thing is to be natural and to, like I said, meditate half an hour every day. Don't think too much about it. Meditation is a very easy technique. You just can learn and do it for half an hour every day, and it has beautiful effects. The three main causes for all lifestyle diseases, whatever it might be, is the food we eat. Like Dr. Jain said, very simple. You should not eat polished cereals. You should
Hmm.
not fry your oils, decrease your salt, and decrease the total intake to maintain a proper weight and to not put fat around your abdomen. That's about diet. About exercise, you need to relax while exercising. A lot of people have heart attacks in the gym because they're really not relaxing during exercising. And you need to have, increase your heart rate to around 80% of target heart rate, which is 220 minus your age, and keep it like that for around 45 minutes every day. And the third important cause for all lifestyle diseases is the mental stress. So for that, again, I would say just meditate. You don't need to look at the factors that are really stressing you. You
Yeah.
don't really need to delve deep into it. No, just sit for half an hour and do it, and that's it. You will have those wonderful effects.
Absolutely. And I think these conversations, like the one we are having today, are going to go a very long way because there's a change which is required on a humongous basis in the society. From the takeaways that we have, from the outside eating that we have moved to the lack of exercise, to spending so much time on various online modalities, etc. So now it is evident that proactive heart care is not just about treatment, but also about prevention and empowerment. Thanks a lot to all of you. Thank you so much, Dr. Anshul Jain, Dr. Deepak Kapila, and Dr. V.S. Ramachandra today for joining us and telling us so much about what our viewers needed to hear. Now, this knowledge and the tools discussed today can help each of us make informed decisions about our health, reducing the risk of heart diseases and improving our quality of life. So let's
Thank you.
take the insights shared by our experts and put them into practice in our daily lives. That's very important. Now, by staying informed, embracing technology, and by adopting heart healthy habits, we can all take charge of our health and pave the way for a future with fewer heart related diseases. So take care and have a good day.